Hello, everyone. My name is Francesca Boncoddo, and I completed my practicum at the Region of Waterloo Public Health and Paramedic Services in Waterloo, Ontario. In my presentation, I will be discussing the project that I completed, which was conducting a public health unit scan of health equity initiatives and GIS mapping tools that aim to improve public health intervention strategies and neighborhood level health inequities. Before we start, I would like to take a moment to acknowledge that the Region of Waterloo is situated on the Haldeman Tract, located within the traditional territories of the Haudenosaunee and Anishinaabe and Neutral peoples. Also, I'd like to thank my supervisor, Shelley Bolden, the Infectious Disease Division at the Region of Waterloo, and Dr. Jeff Masuda for all of their support and guidance throughout this semester. The Region of Waterloo Public Health's mission is to provide equitable access to quality services and programs that contribute to a healthy, safe, and inclusive community. To ensure this mission is being met, the region creates an annual business plan that meets the needs of community and finds solutions for pressing issues. That said, a major issue was found. After the COVID-19 pandemic, the region recognized that during the vaccine rollout, a number of neighborhoods had no connections to public health. Therefore, addressing the public health service gap became a strategic service priority in the pandemic recovery plan. As part of the pandemic recovery plan, a pilot departmental initiative was created, and that is when the Neighborhood Nursing Team, or NNT, was formed. The NNT is a mobile health equity team whose primary objectives are to build relationships with communities, foster trust between clients and public health, reduce barriers, identify areas of need, and improve quality of life. The NNT visits common gathering places in neighborhoods within the Waterloo region to provide a wide range of health services or connect clients with resources in the community. Although we know that there are communities that do not have access to public health services or face barriers to get support, as learned from the COVID-19 pandemic, the challenge is identifying where those pockets of people reside. That said, using a geographic information system, or GIS, could be the solution. To provide some context, GIS can strengthen the public health preparedness, healthcare and service access, and health equity. GIS has been an essential tool for health professionals as spatial data technology can help us understand urban-based health inequalities, uncover gaps in populations we hope to reach, and support public health planning. GIS maps are fully customizable, and with locational intelligence, you can add layers to visually see where neighborhood boundaries are, where resources exist, and demographic data. For example, here is a GIS map created by the region. On the right-hand side, there is a legend or a list of layers, and when you click on one or multiple layers, the data points will populate on the map, as you can see from those different colored dots. Then you can hover over the data point and the title of the location, as well as details will populate. Therefore, a GIS mapping tool can provide the NNT with a more accurate picture of each neighborhood and a layered assessment of what resources, supports, and services exist in those communities to identify if they are in need. Unfortunately, the region has not yet completed a map for this type of outreach work. So my goal was to conduct a scan of Ontario public health units to better understand what other units are doing to address health inequities in their neighborhoods, specifically if they are using any GIS map tools to inform their outreach work. More importantly, to understand if GIS mapping tools can be used as a best practice. The goal of the public health unit scan was to gather information, resources, and recommendations from teams that conduct outreach work. From there, the data collection would inform the planning of the work being done by the NNT and contribute to the development of our own GIS mapping tool. The GIS mapping tool we hope to create would help the NNT plan priority populations to target their efforts and connect clients to resources that they may have barriers to access. The following public health units were contacted and 4 questions were prepared. The 4 questions that the public health units were asked were: 1, what current or past outreach work has your public health unit done? 2, has your public health unit used GIS mapping to support any outreach work? 3, do you have any map layers or indicators you feel are important to include on a map? And 4, based on your experiences with outreach work, what suggestions would you give us to support ours? The results from the public health unit scan are as follows. First, they were asked if they had ever used a GIS map to support their work. It was found that several of the public health units use an interactive GIS map to assist with priority setting, overall neighborhood well-being, distribution of services, and socioeconomic statuses of communities. These maps use neighborhood level data to show key indicators such as demographic data, locations of resources and supports, and how health varies across their regions. Moreover, the public health units were told about our goal of creating a GIS map to support our NNT. So we reviewed what key indicators or data sources they believe would be important to include based on the needs of the communities. Among the public health units, demographic data was expressed as the most important, then food banks, community health centers, and mental health supports. They stated that demographic data can show a wide distribution of key indicators such as age, household, dwellings, income, education, employment, ethnic or cultural origin, languages spoken, and citizenship. These are all important variables as they can highlight high-risk neighborhoods or populations that are more likely to face health inequities, have less access to shelter, food insecurity, have unstable income, poor education, and other determinants of health. The learnings from the scan, the GIS maps, and the potential map indicators were critically reviewed and multiple benefits were found. From this, we learned that GIS mapping tools can show locations of community amenities, services, supports, and resources, assist public health with identifying, tracking, prioritizing, and taking action on health issues, identifying needs of populations, highlighting demographic data, and supporting population prioritization projects and place-based planning and service delivery. The Public Health Unit Scan provided this project with a more comprehensive understanding of GIS mapping tools. It was found that most of these public health units supported the use of GIS mapping to inform public health practice and support health equity initiatives, providing evidence that it can be used as a best practice to move toward health equity at the neighborhood level. Therefore, GIS mapping tools can support the NNT with locating where those pockets of people are that need support and be used to connect clients with local resources and supports to improve public health. Also, I'd like to mention that the results and recommendations from this public health unit scan were compiled into a report and brought forward to the NNT. Fortunately, I will be staying on with the region of Waterloo for the next 4 months, and I will be continuing this project. Hopefully, we'll be able to take these learnings and begin creating the actual map for the NNT to use with these factors in mind. And that concludes my presentation. Thank you.